listening to Community Health Watch on WNHHLP 103.5 FM, New Haven's home for community radio. Insightful conversations, impactful ideas, and voices shaping our community and beyond. Let's begin the dialogue.
Good morning, and welcome to YCCI Amy Zion Cultural Ambassador Community Health Watch Program. I'm Leroy Odinga Perry, pastor of St. Stephen's Amy Zion Church, and I have with our team the Reverend Elvin Clayton, pastor of Walters Memorial, Amy Zion Church in Bridgeport, and Irene Saunders, a registered nurse and a cultural ambassador. And we're so happy to have as our guest Janelle Lawson, Deputy Director and Vice President of Human Resources at Community Action Agency of New Haven, and Lorraine Gibson, amen.
Gibbons. Mm-hmm.
Gibbons, amen. Executive Director, Cardinal Sheehan Center, and President of the New Haven chapter of the National Coalition of 100 Black Women. I'm so happy that you could be with us today. Our subject is really Black Maternal Health Week. It's coming up, and we want to recognize that and raise awareness to that, and to see how we might be able to improve Black maternal health outcomes. According to the CDC, Black women are 3 times more likely to die from pregnancy-related causes than white women. It is crucial for us to take collective action to address systemic issues affecting Black mothers and their families. And this show will look at the Black Maternal Health Project, a community partnership that is doing just that in the New Haven area. So to my guests, if you would just take some time and introduce yourself to us, and the work that you're doing in this area, in this field. Janelle, you can start.
Sure. Hi, good morning. I am Janelle Lawson, and as you shared, I'm the Deputy Director at Community Action Agency of New Haven and the Chair of the Black Maternal Health Project, which is getting ready to celebrate its 3rd year anniversary next week, Saturday. Lorraine?
Yes. Hello, everybody. My name is Lorraine Gibbons. I am the president of the National Coalition of 100 Black Women, the New Haven Metropolitan Chapter, and I also serve as co-chair of the Black Maternal Health Project.
Oh, that's wonderful. Can you tell us why it's so important that we have this conversation and this dialogue in this particular critical period in our history and the history in this country? This is even more important than ever.
Yes, I'll go first. The reason this conversation is really important is because when you think about the impact it has on Black and brown women, you gave statistics in the beginning, and it is still, after all these years later, Black and brown women face disparities more than our white counterparts. And when we consider having children, we look at it as something we want to celebrate, when many times we see sad stories afterwards, either the mistreatment women received during the delivery process or coming home without the child they carried for 9 months. And by bringing awareness, we want women to be able to advocate for themselves and to identify signs that may help prevent the negative outcomes.
Yeah, and if I could also add to that, Janelle, that not only do we want to let our moms know, we really want to share this, highlight this with dads as well.
Yes.
So dads could be partners with moms, and then to let the healthcare providers know that this is a critical issue in our communities. So thank you for hosting this show, and for us to have this platform to have a conversation about this.
Before I get to Irene, let me ask you a question. How did you guys come to develop this project program? I mean, what inspired you? Did you have personal connections with people, or was it just something that you saw a great need that needed to be addressed?
So, as a member of all of the organizations that's in the collaborative, we actually, in the National Coalition of 100 Black Women, when we onboard new members, they do a project. So, some of the sisters during their introductory period came up with a survey that highlighted the number of Black and Brown women in our catchment area who were suffering from the disparities. And as a member of the New Haven chapter of the Links, I noticed that they also had a platform around Black maternal health. And at Community Action Agency, we work in partnership with New Haven Healthy Start. So after having a conversation with the presidents of all of the organizations, we thought it would be a good idea for all of us to bring our superpowers together and bring about change collectively and together instead of making it a one-time event.
All right. Lorraine, I'd like to ask you a question.
Sure.
Community-based programs play a vital role in supporting Black maternal health. Which organizations are involved in this collaboration, and what roles do they play individually and collectively?
Sure. So as Janelle lifted up, there are several organizations that's involved in the collaborative. So it's the National Coalition of 100 Black Women, the New Haven Metropolitan Chapter, and the New Haven chapter of the Links, as well as Community Action Agency of Greater New Haven, and of course, New Haven Healthy Start. There's also, with regards to collaboration and partnerships, we reached out to Southern Connecticut State University, who's helping us, who's the sponsor of the summit, along with various other entities. But collectively, the main groups are the New Haven chapter of the Links, the National Coalition of 100 Black Women, and Community Action Agency of Greater New Haven.
Thank you.
And they all play, so individually, I would say we all play a really collective role, because we really can't do this work individually, right? So while it's, we could say, well, we need New Haven chapter of the Links to connect with your membership, or the National Coalition of 100 Black Women to connect with your membership. Collectively, we need to have everyone on point and to educate everyone so that this way they could drive, greater impact. So collectively, everyone is doing the work with regards to our partnerships.
There's a missing link in this partnership. Where are the Black dads? Where are they in this scenario? Because I think they're hidden figures, but they do play significant roles. I used to direct the fatherhood program, so I know. And I know it's a stretch getting them involved, but I think that there's a way that we can do that. And I think we need to really do something with Black men in this area to be supported.
We agree with you. As I shared, we are entering our third year, and when we created our strategic plan, going forward, we wanted to bring the fathers and the whole family to discuss the impact. And there's also the mental component, because the mental outcome affects everyone who's involved. So we agree with you. We want to get dads involved.
Yeah, and we wrapped up, and if I could just add to that we hosted several webinars throughout the year. And one of the last webinar we had, we hosted it with Daryl Huckabee, 94.3, and that particular session was kind of, earmarked towards dads. So you're absolutely right, and Janelle is absolutely right. That's one of the next topic area that we'll definitely reach out to is our dads, to make sure that the dads are engaged as partners.
Is there funding for this project? Because I know you can't work without funds, right?
Right. So all of the funding is through fundraising, and all of the members of the collaborative are volunteers, and we like to coin this as our labor of love. So each organization does give funds towards this, and our summit is our biggest fundraiser that helps us continue programming throughout the year.
And when is the summit? And how can we participate in that?
Sure. The summit is this coming Saturday at Southern Connecticut State University, and it starts at 10 o'clock and it's going to go until 5. You can find out more information by emailing us at blackmaternalhealth@caanh.net or going on to our Eventbrite page and purchasing tickets. And each ticket sold goes towards supporting this initiative and future programming.
Oh, that's
And the
awesome.
event also is a day that's going to take you on a journey of the pregnancy cycle. So before, during, and after, we have legislature who's going to be in attendance. Speaking of new policies that's coming down the pike, we're going to unpack the implicit biases that people aren't aware that they have and are all, sometimes considered blind spots. We're going to remove the blind spots and give clear vision to everyone. And we're also going to talk about the supports that are available for women, whether it's a doula, a midwife, or just finding a birthing center they would like to attend. We're going to have Dr. Monique Rainford in attendance, and she's going to share information about her birthing center that's opening in Hamden in a couple of weeks.
Wow.
And also at this, if I could also add to that, also the summit, which is really interesting this year, we will provide continuing education credits, CEUs, for healthcare providers. Nurses, social workers, or healthcare providers with respect to attending the summit. So it's a lot of good information, conversation, and the plus is that if you are a nurse, if you are a social worker, or if you are a healthcare worker, you could attend the summit and get 5 CEUs.
Wow.
Okay.
That's a great perk.
Yes, an added bonus.
That is great.
I want to ask Irene a question real quick. She is a nurse, so you're hitting down her alleyway, and it's good to have people on the show who have direct contact with the medical side, the research side, the side that that people don't see or hear about or know about. I know that she must come across a number of families who have suffered due to the whole issue of Black maternal health, and so we want to hear from you, Irene.
Well, I can add even a personal experience that I've had. I've had a niece who had a problem during her childbirth. She developed preeclampsia, which is a complication that can happen during childbirth or during your pregnancy. It's a condition that causes a pregnant mom to have very high blood pressure, and it can be overlooked. So that's why it's important for us to advocate for our moms to be consistent with their prenatal care, so that even though they're feeling well, they're not going to have conditions missed. And we know that there are health conditions that disproportionately affect our Black moms, and preeclampsia is one of them. And it can cause a baby to be born earlier than 37 weeks, which can lead to a hard course for baby and mom after delivery. So I think it's important for us just to advocate for our moms to get consistent prenatal care, early prenatal care, and just to be consistent with it and to follow up with their caregivers.
Thank you.
I'd like to go back. You mentioned about this birthing center in Hamden. Can you share a little more about that?
Yeah.
Sure. I don't want to overspeak because I don't know all the parts of it, but I know it's going to be a holistic center that are going to have classes and everything for moms and like a support group where they can come and be in an environment with women who look like them, get questions answered, and navigate through the birthing process. And there will be doctors and nurses there to provide additional supports.
Will this support continue after the birth of the child?
Yes, from what I understand. Yes.
Oh, that is really great.
That is.
Yeah. How do we sign up, people?
We can find out more information from Dr. Rainford and provide it for you to share on your radio show. And it may be good to also bring her on and interview her so she can share more with you directly. She's actually a physician at Yale.
Beautiful. Beautiful.
And she wrote a book on Black maternal health. I was trying to see if I had it around my office, but I don't have it at the moment. It must be at home.
Ah,
And another thing we wanted to share is, yes, we're offering the continuing education credits. And this is more of a community problem about the injustice that people face. So we want everyone in the community to come out and listen, whether you're in at a childbearing age or if you have daughters who are considering it. So you could be there and advocate for them. So I wanted to make sure I lifted that up.
yeah.
Okay.
Did you have to sign up for the summit ahead of time, or will you allow people just to come in if they show up there that day, or what was the
Great
process?
question. So tickets are actually on sale until tomorrow, and we're going to see if we can have an option where they can pay at the door. With Southern, we did have a cutoff date because we have to, for security purposes, we have to let them know how many people are going to be in attendance. So that's why we extended the ticket sales until tomorrow at 5. And we're also providing lunch. So there's a count for the food as well.
What will be the cost of the summit?
Right now, the cost is $75.
You may have to give somebody a scholarship.
I know, and we took the cost under consideration. However, getting the venue, providing the meal, and getting the continuing education credits actually came with a cost. And we did our best to keep it affordable. And at the same time, create the space to raise money to continue this initiative.
Okay.
And, you know, we also did, along with the scholarship comment, we did have individuals who were able to provide scholarship to college students who are majoring in, nursing or any healthcare or becoming social workers. So that opportunity was extended to some of the local universities as well, to those students.
Great. Great. Now, we know that social determinants of health and poverty and quality health care is a big problem with maternal health. But we understand that the problem also reaches with those who have means. Can you speak about that, or anything changes anything has changed in that area. Because whether you have money or have insurance or living in a food desert or Serena Williams,
Right.
there seems to be a problem with our sisters getting the proper health care.
Yeah, I was going to share that the playing field for this is leveled. It doesn't matter what your economic background is. It's based on the color of your skin, and how people perceive you and the biases they bring into the situation. So we hear about Beyonce and celebrities that go through it. And the work we've done over the last 3 years, we hear about people right here in Connecticut who experience disparities, and some of them were actually doctors. And if they didn't advocate for themselves, their outcome wouldn't have been great. Lorraine, did you want to add anything?
No, that's it. That's it. It really doesn't matter, your economic status at all. So there's so many implicit biases. We've heard from individuals within our own organization saying that the perception of angry Black women or Black women are strong, they could, take the pain. We've heard so many different things. So it's so important that, we host these webinars, we get out into the community, we have individuals, have partners to be there with them as they're going through the process, to able to help advocate for themselves, talk to legislators to make sure that we get the word out to the community so we could actually change outcomes and have a greater impact with, successful birth outcomes. And so it is alarming. It does not know any type of, restrictions when it comes to economics. So we definitely need venues like the radio station, the summits that we have, the webinars, getting to the caregivers, the doctors, and of course, everybody, to let folks know that we are watching and this is a crisis and it needs to stop. And we've got to have better outcomes for our Black and Brown communities.
And when you say that, there's one way that my colleague came up with a magnificent idea, an exposure program to expose our young people. Dr. Perry, maybe you should just share that with us, with our audience and with our guests, because that's a wonderful way that in the future, there'll be more people of color as physicians and healthcare workers.
Yeah, I think that's a great point, Doc. So what we realized in healthcare system that there are not enough Black and Brown people in the system, not enough Black doctors and nurses in the system. So one of the things that we asked Yale to do was to come up with an exposure program where we could take young Black and Brown people, marginalized from rural areas, those who thought that they never had a chance in this field, and go through a program of exposure with them. Once you know about something and you get a hands-on kind of understanding, then you may gravitate toward that. And we thought that if we could do that, we could change the face of medicine. Like I'll give you an example. I have a black doctor in New York. I had a Black doctor, Dr. Diet, whose daughter is a doctor in New Haven. I go in and see Dr. Diet. I could be there 20, 30 minutes almost. I go see my white doctor here in Branford. I'm in there 8 minutes and he's saying, bye. So, those are some of the things that are just inherent. And, and I do believe that implicit bias is always a part of the picture, the silent elephant in the room. They see Black women, they think they're stronger than other women. They don't need medication. They don't need to see their doctor often, because this is what they do. And I think that's an erroneous assumption. So, Irene, when you think about this as a nurse, what would you say to a Black woman that you knew was pregnant and getting ready to go through this whole cycle? Would you say to her, look at the doctor that you choose? Would you say to her, do you have the finances do you need any help? I mean, what kind of questions you think might be relevant here for a young person who is pregnant and getting on this journey and at this particular time?
Irene, hold your thought just for 1 second. I
Okay.
just want to share with our audience that we're listening by way of WNHH 103.5 FM.
Well,
WNHH 103.5.
Amen.
All right now.
all right. I think it is important for a woman to choose a practice that she wants to go to and a doctor that she feels comfortable with. I think that plays a role in your care for sure, because if you're comfortable with your doctor, I think it's important because care providers need to practice cultural competency to make sure that Black and Brown mothers feel seen and heard, to lay a foundation for their care so that they will feel like the communication is open, that they have trust with their provider, and that their voice is going to be heard if they have concerns. They don't want to be in a practice where they don't feel comfortable talking with their practitioner. So I think that is a number one thing, is for them to have a doctor that they're comfortable with. And I think that your birthing center that's going to open is going to provide great opportunities.
Yeah, I think the more people that know about this center is going to have the greater the impact it will have. So we really want to push that along with the summit that you're having on Saturday. I'm trying to see where I can find $75 in my piggy bank.
Yeah.
I just spent $75 to see Jasmine Crockett in Waterbury, so my funds are kind of limited. I'm on a tight budget here under the new administration in America, and the way the stock market is going, I'm scared. So,
And I agree with you, and I think timing is everything. And in a situation in the climate, this may be just one more thing you want to invest in because it brings awareness. And we encourage other organizations to partner with us too, so that way we're all not doing segments of it. Because strength is power. So the more women who join and advocate with us, the better the outcomes would finally be. I could think a couple of months ago, I was interviewed by a reporter, and the question was, since your last summit, what's changed? And I had to kind of chuckle and say, it's interesting you want to change in 365 days when this is a systemic problem. It's going to take a little bit longer. And she was like, wow, I didn't look at it that way. So I'm sharing that to say it's power in numbers. And when we all believe in something and we focus on it together, that's what brings about the change.
And I also think shining the light on the subject by having these summit and drawing attention to the subject matter is what's going to help as well. Because although it's been a systemic problem, it's been one that has existed and has been allowed to exist. So now we're going to shine a light on the subject and increase awareness. And I think that's what's going to bring about the change.
I agree.
Yeah. You advocate, you have your ace in the hole is advocacy, community engagement, and education, which I think is phenomenal. And each one of those topics, I guess you could talk about for hours, like the advocacy efforts and policy changes that are needed to address this healthcare disparity. You want to talk a little bit about some of this ace in the hole you got?
Sure, Lorraine, did you want to take that one?
I'll let you go and then I'll chime in.
So we came up with the platform ACE because when you think of all of the organizations involved, advocacy is one of the pillars. So we advocate by going up to the Capitol and also looking at different bills that are coming down the pike. So a couple of years ago, we worked with Representative Porter in supporting Bill 986, which was helping doulas get reimbursed. And we really believe in that because a lot of times women of color partners may not be available, and it's good to have a support in the room and help you navigate it. And most recently, we were up at the Capitol, and that's why we're excited. Representative McGee and Representative Belton are going to be at our summit because there's some other things they're looking at. And one is a report card for healthcare facilities so that they can begin to monitor the treatment and the care that women get. And it's going to be reported on this card. And it could help the administration of hospitals take a look at what people are receiving. Lorraine?
Yeah, so we're going to be following that very closely to see, whether or not it passes through this, it goes any further from a House bill. So we are actually, with respect to that as well, a couple of years ago, we worked collaboratively with New Haven Healthy Start with respect to making sure that there were breast and chest feeding sites throughout the area. And so that was successful. We identified, I believe it was 100 sites within the greater New Haven, greater Fairfield County region that would be able to provide support for nursing moms. And so that's part of the advocacy, making sure that companies are aware that it is the law that they need to provide a site in their workplaces so nursing moms can actually nurse in private. And so with respect to, I'll just continue on, Janelle, is that okay with the community engagement part of it?
Yes, go ahead.
Yeah, you've heard a little bit about community engagement, what we're doing, with the webinars and of course with the summit. We're looking for, a couple of weeks ago, I should say, that we partnered with the African American Women's Summit. We actually presented at their summit a couple of weeks back, where we lifted up, we had a panel discussion with several doctors, Black doctors, and then nurse, and myself as a moderator, who led that discussion with respect to just clearly highlighting to the community about the disparities, and what we can do in terms of achieving those better outcomes. And we also lifted up the summit to get more information. So we pretty much whet their appetites and to make sure that we got the summit information out, because the summit is pretty much all day, but it's filled with great information. And just ways that we could, educate each other, our communities, moms, dads, our healthcare officials, the legislators, the universities, students, and families. And so our community engagement piece is really wide and far. And near as well. And with respect to education, that's what we also do, right? We're educating the population, educating individuals about not only the disparities that exist and the impact those disparities have caused and created, but where do we go from here? How can we help to alleviate and reduce those the numbers that we're seeing? So that's why we, have the term ACE. Advocacy, community engagement, and education, which is fitting, as Janelle said, because all of the organizations that's involved with the Black Maternal Health Project, that's part of their pillars: advocacy, community engagement, and education. So it was fitting that these organizations came, together to create the Black Maternal Health Project.
I think with the whole idea of trying to get to the core, the systemic part of this, there is a need to reach the healthcare professionals as well as to reach those individuals in the public to help them navigate through this. And I can see your organization is going to be growing. There may be a few dads joining you. There may be some churches and some community leaders who will see your vision here and will want to reach out to you. Is there a way they can contact you, or website or anything like that you might have, or is it through CAP agency?
Sure, it is through the CAP agency currently on their website. If you click on the initiative button, it'll take you to the Black Maternal Health Project. We're also on Instagram and Facebook. If there's questions, the best way to contact us directly, again, is through the Black Maternal Health at can.net, or to call, and the number is 203-859-6637.
Oh, that's great. You know, you're going to have to say that again because folk don't write it like they used to.
Okay, sure. The telephone number is area code 203-859-6637.
All right. Thank you so much. Thank you so much. You know, when I think of this broadness of this venture that you're on, it's overwhelming. And so I know it must be overwhelming for the moms as well. You know, I remember when my wife was pregnant and then she was saying, I need some vitamins. I'm thinking, what are you talking about? I need special vitamins. How much they gonna cost? And you know, are you gonna go to this session with me? And then there's the whole question of, you know, all the stuff that the baby needs when the baby comes in. So you have these showers to help support. And so the Black community has always supported Black maternal health. I mean, I'm not sure how it works in the teen area in terms of teen pregnancies. Maybe that's an area that we need more strengthening in, or to take a better look at, because you know, it's a scary area. And I don't know if they know, because in the past, grandma and mom would be there to be your doula, so to speak. They'd be there to help you pull through this and push through this. Now, you know, grandma and mama ain't there now necessarily. So where are the arms and the caregivers that we can direct young people to go to? Just for the education part that you talked about.
So our webinar series that Lorraine lifted up, we have been doing it every fall with providers in the area, and many of the providers that have been on the webinar actually look like us. So it gives the community members the opportunity to either put in the chat or ask questions during the webinars. This summer, we're also going to be doing more community initiatives in the community to open forums for mothers and young women who want to come and find out more information. For the summit, we thought it was important to involve the young women. So we did look at the segment of education for NCBW, and we invited the students and their parents to come, because during a conversation with an educator, Lorraine and I was surprised that youth need to be educated at a younger age than previously, and it actually starts in elementary school. So we wanted to reach out to participants in the STEM program so they can come and gain awareness and also see people who look like them in careers that they might want to pursue. So I don't know if there's anything you wanted to add to that, Lorraine.
No, that's fine. And then, you know, for New Haven, we have, I believe there's someone within our organization that's reaching out to a school in New Haven with respect to, you know, whether they have moms, young moms at that school to invite those or to make those students aware of the summit. and to be able to provide opportunities for them to attend.
That's great.
Does your program offer any type of like a mentorship program that you have some moms come back and say, hey, this was my experience. And maybe if I had done this or done that, I would not have gone through what I've gone through. That could be an idea for the future, because really there's no teacher like an experience to come back and say, hey, if I had it to do over again, I might do this, or this is the path I would have taken. Or here are some tips that can help you as you're going through this.
Thank you for that. I think that's a good point, and we will add it.
Yes.
Yeah, if I can just lift up Reverend Robin Anderson. Do you know her? She's a cultural ambassador, but she has a program in a Black Ministerial Alliance called Pregnant with Possibilities. And it's a phenomenal program. The moms get to meet together and discuss and get support from each other. She works with them on social determinants of health. And she has a doula program that's built into the whole program. So we're going to, our team will get back to you. We mentioned it to Amos, but we'll get back to you so that you can at least have that information, you know.
That would be great. Thank you.
Yes, the Ministerial Health Fellowship of the Greater Middletown Health Enhancement, and they have this program, Pregnant with Possibilities, and it's awesome, awesome program. She's a wonderful person to talk to. You guys are on the same page, so you know you might be able to draw strength from each other and ideas as well.
Sure,
that's fantastic. Yes, great.
Again, we want to thank our listeners for tuning in. You are listening to YCCI Community Health Watch Show on WNHH 103.5 FM.
All right. Now, are there any events that normally lead up to the summit so that people can, like, in the future, kind of look toward, you know, the trail that's going to lead us to the promised land?
Sure. It's our webinar series that starts in October, and it goes for 5 months. And again, we always go from before, during, and after in pregnancy. And this year we highlighted the importance of screening, because knowing if you have the sickle cell trait and the impact it could have is very, very important. And although my daughter is 32 years old, when I had my daughter, that wasn't something I knew about. And when I checked around, a lot of people don't know the importance of screening. So we had Dr. Dajna Harp and Dr. Cynthia McCraven, as well as Dr. Jennifer Pierre, shared the importance of pre-screening. And Maritza Bond, the health director of health at the city of New Haven, she also shared alarming statistics. And it shows the importance of people understanding that once, if you're considering, you have to do work too to have a healthy baby. And we also broke apart the 4th trimester that a lot of people don't identify with, and it comes to mental health. And Black women are 5 times more likely to face postpartum depression, suicide thoughts, especially based on the social determinants of health. And we have to figure out ways we can help them get supports around these issues.
Yes, that's awesome. So how can the community support the Black Maternal Health Project?
Come to our summit on Saturday.
Oh, okay.
No, and tune into our webinar series and everything.
Is it all day Saturday? And how many people do you expect to have?
We expect to have probably 120 in attendance. And it starts at 10 and it should be over at 5. And we carved out space to have an hour lunch so people can network and ask questions with the presenters.
Oh, that's wonderful. Wonderful. Clayton, you have any questions?
Have a surprise. Someone from TikTok is going to be there and share her birthday story. She actually is going to share that if her husband wasn't in a room with her, she wouldn't be here to tell her story. So I don't want to give too much away, but her and her husband are going to be there at the summit and share what they went through and how through the grace of God, she's able to come and be our wow factor.
That's a good point right now. Can you share some success stories or impact changes that have occurred as a result of this project?
Lorraine, do you want that?
Yes, so after each webinar, we have a survey. And I can't pinpoint my hands on the survey, but the survey tells us the difference that we're making in the communities and for those individuals that are coming on those particular webinars. And so we know that we're making a difference because when we look at the knowledge gained, folks are saying, oh my God, I had no idea. Oh my goodness, I'm going to do this differently. Or, oh my goodness, I'm going to now share this information with someone else. So knowledge is power. And what do you do with the power? Just don't keep the power to yourself. You've got to share, you got to educate. And so our webinars that we've held since October has been very, very, very impactful. And we hope to, as Janelle says, after the summit, we'll reconvene and we'll plan out again the summit for on the actual webinars for the 2025-2026 years. One of the things we do want to include are more impactful stories, right? So on the webinars, so now you're hearing from someone who has our webinars or the summit, summit from last year, or even the summit from this year, the difference that we've made in that person's life or that partner's life as well, because we expect that men will be able to attend the summit and those who attended the webinars. And it's also important too to hear from the doctors, because the doctors were there to also educate the doctors. And so we really want to hear from them as well. I know that this will be a difficult situation with them, hearing from them in terms of things that they may be doing differently. But it's important for them to have a voice as well to let us know and to also let the communities know.
How many webinars do you have per year?
Do you want to take that, Janelle?
It's 5 webinars a year.
And so
we go from October to March. And it's typically on a Wednesday evening from 7 to 8.
And
they're free of charge.
Okay. Are they well attended?
Yes. We started the webinar series a year ago. And since then, and with the support of Daryl Huckabee, announcing it on YBC and social media.
All right.
We have been able to increase viewers 50%. So each time we have a webinar, more and more people are logging in and they find the information helpful and they have, wow, I wish I would have known moments.
Mm-hmm.
We have our checkup meeting on Saturday, so that prohibits us from going. And that's like all of our Amazon churches in Connecticut anyway. But we're going to donate 2 registrations to your project because we want to support you, and if we can we'll pass it on to you.
Thank you.
And I'm not in Connecticut this week, where I would definitely attend. I'm definitely interested And we'll start to watch the webinars and plan to attend your next summit.
And sure,
Awesome.
you're more than welcome to be a presenter as well. So when you get back, we can chat about it. Okay.
And share the information, though you may not be in Connecticut this week.
Yes,
Yeah.
Please do share.
I will.
This has been a wonderful collaborative meeting, and I really appreciate you guys and the work that you're doing. And we just have to keep more in touch. And I think one of the things that might help strengthen all of us is that if we collaborate with the Black church more,
Yes.
in some ways, I think we might even be able to reach a broader audience, because that's the only audience that every week is going to meet with 100, 200, or 1,000 people in one place. Even though the men aren't there, the women are.
That is true, because we talked about that. Yes, so when we met, we did talk about reaching the Black churches and making sure that those who are attending church get the information out to their pastors and the members of the church as well. So yeah, points well taken. Mm-hmm.
So we're told that we're out of time. So we just again want to thank you so much, and we're gonna share this program throughout our network, and hopefully folk will see it and will respond. Thank you so much again to all.
Thank you for having us. We appreciate it.
Thank you again.
Thank you.
You're listening to the Community Health Watch Show on WNHHLP 103.5 FM, your home for community radio. Stay informed, stay connected, and take charge of your health. We'll see you again next time, right here.